Hey guys, welcome to case 4. Let's get right into it. Okay, so this is a genitourinary case, and let's see what's going on. So we have a 28-year-old man, comes to the physician because of a low-grade fever and also painful lumps on his left groin for the past 5 days. The lumps discharge purulent fluid since yesterday. He has had a shallow, painless lesion in the penis 4 weeks ago, but was too embarrassed to seek medical attention, and it has resolved in the meantime. He has smoked 1 pack of cigarettes for 14 years, sexually active with multiple male partners, and uses condoms inconsistently. Temperature is 38, so he has a fever. Which of the following is the most likely diagnosis? So which organism causes this? Alright, I'll give you a second to choose, and then once you're ready, you can pause here, and then we'll go on and discuss the answer choices. Alright, so if you chose Chlamydia Trachomatis, you are correct. Now a lot of you guys might have gotten tripped up with the painless and painful parts, so let's discuss the lesion. And here's an example of what this lesion could kind of look like. Alright, it was just a hint. So let's go through the options. Haemophilus ducreyi. Okay, this causes the STI, also known as chancroid, and you can remember Haemophilus ducreyi makes you cry, so it's painful. And chancroid it just sounds painful. I don't really have a way to memorize it. So we have a painful lesion with suppurative inguinal lymphadenopathy. These ulcers also tend to release some yellow grayish exudate, and there are no systemic symptoms. So remember, systemic symptoms are things like our fever. So because the guy has a fever, it doesn't really point to ducreyi, and although his lesion his lymphadenopathy became painful, his original lesion was not. So really not going for Haemophilus ducreyi for this answer. Next, Treponema Pallidum. So this causes syphilis, as you know. So this is one of the answers that might have tripped you up, because at one point it said there was a painless lesion. So this causes a painless genital ulcer, also inguinal lymphadenopathy, but the inguinal lymphadenopathy is non-suppurative, which means it doesn't make pus. Our adenopathy in our guy was producing pus, so points against this answer. And there's also no systemic symptoms, at least for the primary version of the syphilis. Once it goes into secondary, where we have condyloma and those sorts of things, we can start getting systemic phase. But just for our case, no systemic symptoms initially. And remember, there's a window period where syphilis doesn't really present. That's up to 3 weeks. So 27 days is it can hide out, and it won't even show the primary lesion. And then we'll get the secondary version after that. Okay, or the primary version after that, and then it'll progress to secondary. Yersinia pestis. This also causes plague. Okay, so this is transmitted by fleas, which bite you, and then at the site of the flea bite, you're going to get these tender lymph nodes called buboes. So we do have tender lymph nodes, which is correct, but unless the flea specifically bit him in his inguinal area where we saw the inflammation, this is super unlikely. Also, there's less than 7 cases a year of plague in the US, and they're not classically associated with genital ulcers. So the chances of this answer is super low, even though he did have fever and a suppurative lymph node. Okay, usually the bite sites are on the leg. HSV2, so herpes virus, herpes simplex 2, that causes genital ulcers. So there is fever in this one. There's also tender inguinal lymphadenopathy. Okay, so we have those. But these are classically multiple grouped painful genital ulcers. So you'll see these little vesicular ulcers, usually in a group, usually more than one. The inguinal lymphadenopathy is also non-suppurative, so there's no purulent drainage from these lymph nodes. So not really looking at herpes here, even though it is painful and things like that. Don't worry, we'll go through all of these at the end one more time. I've made a table for review. Then we have Klebsiella Granulomatous. This causes Granuloma Inguinale. Okay, you have to remember both these names for a lot of these diseases, because they'll try to trip you up by giving you either one or the other. So make sure you just remember both the names. Painless lesions on the genitals initially. Lesions do not resolve spontaneously without treatment. So in our case, our guy had a lesion, it resolved, and then the lymphadenopathy came back later. This doesn't resolve, it just progresses worse and worse and worse, alright? So this granulation tissue starts destroying surrounding tissue, it's necrotic. These lesions are very classic, beefy red, suppurative, and they bleed easily. So we saw on our lymph node on our guy, or on our lesion, had a smooth edge, sort of. It was a little bit pearly, kind of looked like this, all right? But if we, let's say we had Granuloma Inguinale, it would be more into the skin, and it would be red, beefy, very pussy, and releasing kind of exudate, all right? So that's really an easy way to differentiate them. If it has this smooth border and it's kind of bulging out, Klebsiella is more of an open lesion, all right? Then we have Chlamydia Trachomatis. The L1, L3 version causes lymphogranuloma venerium. Now you know you have A to C, which usually causes eye problems and things like that. And then we have D through K, which causes genitourinary infection. Lymphogranuloma venerium affects the lymph nodes in the inguinal region. And it's very common in men who have sex with men, or most common, sorry. So our guy falls into this category. We also have systemic symptoms, so fever, malaise, chills, things like that, and our guy had a fever. And how do you treat this? Well, you have to treat with doxycycline or macrolides. You can use erythromycin, for example, if you choose to go with a macrolide. And if you don't treat it, you can get chronic lymphedema in the inguinal region, strictures in the anogenital tract, and infertility. So you really don't want this. Again, similar to gonorrhea, you can get sort of a Fitzhugh-Curtis syndrome, pelvic inflammatory disease, if you let chlamydia go unchecked. All right, so let's go through a table just to summarize these lesions, these genital lesions, and I hope this will kind of bring everything together. All right, so we have our name here, our organism, and then we'll go through a couple key categories of how you differentiate. So whether it's painful or not is very important. So which ones are painful ones? Haemophilus ducreyi makes you cry, painful, okay? Genital herpes, painful. Those are the only two painful ones. Everything else painless. Chlamydia, painless. Klebsiella, painless. Syphilis, painless, right? No pain. Next we have how the lesion looks. Now this is kind of tough sometimes because lesions can look similar in some cases. Chancroid, usually it's up to 20 millimeters, 2 centimeters. It's a necrotic, has a necrotic base. It's pretty well demarcated. Syphilis, it's punched out. You'll classically see this on the head of the penis. You'll see that little punched out smooth lesion, but they can really give it to you anywhere, on the penis, on the vagina. So don't depend on that. Then we have genital herpes. These are grouped vesicular lesions, so pretty easy to spot actually. Genital herpes, you'll see it on the picture. You can classically just snipe it from there. Granuloma Inguinale, these are beefy red, right? As we discussed, they're kind of eroding into the skin and not smooth like the lesion we saw in our picture. And lymphogranuloma venerium, these are initially they're small lesions, right? So what we saw was the secondary version where the small lesion disappeared, and then we have these inflamed lymph nodes filled with pus. All right, so initially we have a small indurated lesion, then we have the inflamed lymph nodes. So here we have our lymph nodes, how we describe each of them. A suppurative means it's draining pus or not. Okay, so chancroid drains pus, and what else drains pus? Lymphogranuloma venerium. All right, but one is painful and one is not, so that's how you differentiate them. Okay, syphilis has lymph node involvement but does not drain pus, and neither does herpes. And Granuloma Inguinale, so Klebsiella, no lymph node involvement. All right. Then we have systemic symptoms. Now the only one really here that has systemic symptoms is lymphogranuloma venerium, right? And they gave you Yersinia pestis as another one where you could potentially get a systemic fever. So really, if they give you a fever with a genital lesion, you can just go straight to chlamydia. All right. And then for fun, I included the treatments here. So for chancroid, you can do an oral azithromycin or an IM ceftriaxone. Syphilis, this is a very easy one, intramuscular penicillin. Now, they'll try to trip you up with this answer choice because let's say they're allergic to penicillin. Then you would switch them to doxycycline. But there are two cases where you would not switch them to doxycycline and you would instead desensitize. All right, so you would desensitize for neurosyphilis, so if it's affecting the brain, or if it's a pregnant patient. Those are the only two cases where you would not switch it to doxycycline and desensitize them to the original penicillin. All right, so just watch out for this answer choice right here. Then we have genital herpes, that's oral acyclovir, granuloma inguinale, oral azithromycin, lymphogranuloma, venerium, oral doxy. Alright, so that's just an extra column I included just to review the treatments.